Welcome back, medicos. Subsequent to my last video on the cutoff marks for deemed universities, some of you have requested whether I can do a video specifically on Tamil Nadu deemed universities. You have asked for the cutoff marks in Tamil Nadu deemed universities, college-wise as well as branch-wise. So in this video, exactly that's what I have done. I've given the cutoff branch-wise, and within the branch, I've given you each college what is the closing rank. So I will show you what is the closing rank, what is the NEET score for each branch, each college. And also I will show you whether all the seats had been taken up or not. Because some of the courses, particularly non-clinical courses, not all the seats, there is demand in round one. There are some unallotted seats. So I will show you that also, because sometimes when we don't look at that unallotted seats, the cutoff may look slightly wrong information to be displayed. So that's why I also want to show that information. So with this, let's get into the details which you are interested to see. Fine. So what are we going to look at? We are going to look at only the Tamil Nadu state. And within that, we are going to look at only deemed universities. And within deemed universities, we are only going to look at the self-financed merit seat, or the paid seats quota, or deemed quota, or general quota, right? These are the different names used for this category of seats. Self-financed merit seat, which is a new name MCC has introduced in this counseling. Previously, they used to call it as deemed quota or paid seats quota. So let's look at that. So I'm starting with the branch that has the highest cutoff, and then we will go to the branches with the lowest cutoff. MCH neurosurgery, that's the course with the highest cutoff. In Tamil Nadu deemed universities. Of course, there is only one seat available for this particular course that's offered only by SRMC, Sri Ramachandra Medical College, and that one seat has been taken up at an All India rank of 16,449, which is equivalent to 528 marks, right? I've shown one seat, that one seat has been taken up, or that one seat has been allotted. We cannot say it is taken up. Now it is allotted in round one. Whether that candidate will join or not, we don't know. We have to wait for the round two seat matrix. Then only we know whether the candidate has joined or not. But as of now, the seat has been allotted. The second branch is MD, Radiation Oncology. Again, this course is offered only by Ramachandra Medical College in Tamil Nadu. And the 3 seats were taken up at a closing score of 443 marks. MD Dermatology, 35 seats are available in Tamil Nadu deemed universities, and all the 35 deemed university seats had been allotted. Now let's see one by one. Ramachandra closed at 542, Vinayaka Mission Salem 487 marks, Savita 475, SRM 470, Chettinad 459, Meenakshi 450, ACS 436, Satya Sai 431, Balaji 402. Here you can see how many seats are available in this college and how many seats are allotted. 8 seats are available in Ramachandra. All the 8 seats are allotted. If there are any vacancies, I will also show you that. Next, let's look at MD General Medicine. MD General Medicine, there are 117 seats. The 117 seats, the closing score is 395. Now let's look at the cutoff college-wise. Once again, Ramachandra. If you see most of the branches, Ramachandra is the topmost college in terms of cutoff. Tamil Nadu students, SRMC is the most preferred deemed university in Tamil Nadu for most of the branches. Of course, some of the branches, there are other colleges have taken priority. But if you look at most of the courses, SRMC stays at the top. So for general medicine, it closed at 522, SRM 492, Chettinad 454, Savita 453, Meenakshi 435, ACS 432, Vinayaka Mission Salem. Of course, I'm not covering Karaikal here. I'm only looking at Tamil Nadu colleges. Tamil Nadu colleges ketinga, Tamil Nadu colleges mattumna kuduthirken nanu. I have not included Puducherry. Vinayaka Mission's Salem and 420 marks, Satya Sai 404, Balaji 395. Next, we will look at MD Radiology. There are 61 seats available in Tamil Nadu deemed universities. Once again, Ramachandra is at the top with 540 marks closing score. SRM 494, Vinayaka Mission Salem 469, Chettinad 468, ACS 459, Savita 448, Meenakshi 448, Satya Sai 416, Balaji 387. Next, let's look at MD Pediatrics. 76 seats are available. Once again, Ramachandra at the top with 496 marks, SRM 461, Savita 427, Chettinad 420, Meenakshi 406, ACS 403, Vinayaka Mission Salem 400, Satya Sai 374, Balaji 369. So 369 was the closing score for MD Pediatrics in MCC Round 1. Next, let's look at MD Emergency Medicine. There are 21 seats available in Tamil Nadu deemed universities. Ramachandra stays at the top with 448 marks, Chettinad 423, SRM 394, Vinayaka Mission Salem 377, ACS 366. Moving on to gynecology. Gynecology, there are 80 seats available. Ramachandra at the top with 494, SRM 467, Savita 440, Vinayaka Mission Salem 415, Meenakshi 400, Chettinad 398, ACS 396, Satya Sai 370, Balaji 354. Now we move to MD Sports Medicine. There are only 11 seats available for this specialization. And this is one specialization where Ramachandra is not at the top. Ramachandra is at the second position. Chettinad is at the top. Of course, they have only 2 seats, whereas Ramachandra offers 7 seats. But even then, right, Chettinad closed at 386. Ramachandra is closed at 362. Savita, 353 marks. Then MS Ophthalmology, there are 43 seats available. Ramachandra at the top with 455. ACS 409. Savita 393. SRM 387. Chettinad 371. Balaji 360. Vinayaka Salem 356. Meenakshi 347. Satya Sai 346 marks. Next, let's look at respiratory medicine. There are 37 seats available. Ramachandra closed at 466, SRM 433, Savita 427, Chettinad 397, ACS 378, Meenakshi 377, Satya Sai 353, and Balaji closed at 340 marks. MD Psychiatry, there are 29 seats available. Ramachandra at the top with 456. SRM 418, Savita 383, Vinayaka Salem 368, ACS 365, Meenakshi 361, Chettinad 351, Balaji closed at 338 marks. MS ENT, there are 49 seats available. Ramachandra 423, Savita 370, Vinayaka Salem 356, SRM 348, ACS 344, Chettinad 335, Balaji 325, Meenakshi 323, and Satya Sai closed at 321 marks. General surgery, there are 145 seats available. And if you look at the cutoff, once again, Ramachandra closed at 485, SRM 393. So there is a big difference between Ramachandra and SRM. Savita 366, Chettinad 360, Vinayaka Salem 349, ACS 344, Meenakshi 327, Satya Sai 319 marks, Balaji 306 marks. Let's move to orthopedics. There are 97 seats available. Ramachandra at the top with 446 marks, SRM 381, ACS 372, Savita 361, Vinayaka Salem 351, Chettinad 330, Meenakshi 323, Balaji 309, and Satya Sai 304 marks. Anesthesiology, this is another branch that has more than 100 seats. 118 seats are available. Ramachandra 394, Vinayaka Mission Salem 348, Savita 333, SRM 325, Chettinad 317, Meenakshi 315, ACS 310, Satya Sai 305, Balaji 303 marks. MD in transfusion medicine, there are only 10 seats available. Ramachandra closed at 323, Savita 310, and Vinayaka Mission Salem closed at 286. Now, courses below these, after these branches, most of them, the seats were not filled up, right? There are seats vacant. Not all the seats had been filled up. Like biochemistry, out of 22 seats, only 7 seats are allotted. There are about 15 seats are vacant in MD biochemistry. So I'm not going to go through the cutoff marks. Physiology, out of 26 seats available, only 2 seats were allotted. 24 seats, there is no candidate. Candidates are not even asking for the college, right? So out of 26, only 2 seats are allotted. Community medicine, again, out of 48 available seats, only 21 students have asked for it and 21 seats were only allotted. 27 seats are unallotted. There is not even candidates asking for this college. Anatomy, out of 23 available seats, only 2 seats were allotted. 21 seats, there are no candidates. Pathology, reasonably filled up. Out of 63 available, 54 seats are allotted. About 9 seats, there are no candidates. Pharmacology, out of 26 available seats, only 19 candidates were allotted seats. 7 seats, there are no applicants. There are no candidates. Candidates இருந்தாதான் seat கொடுக்க முடியும். Candidates கேட்கவே இல்லை. கேட்டதே 19 பேருக்கு சீட்டு கொடுத்துட்டாங்க. That is pharmacology. Even someone with like just pass mark கேட்டிருந்தாங்கன்னா they would have also got a seat. Same with microbiology. There are 32 seats available, but there are only 17 candidates interested and 17 candidates got the seat and the remaining 15 seats are remaining vacant. And coming to the last specialization, which is forensic medicine, there are 17 seats available in Tamil Nadu deemed universities, but only 8 candidates are interested. 9 seats are remaining vacant. So overall, if you look at the seats were allotted until just the pass mark. It's only that candidates are not available for some of the branches, particularly non-clinical courses. Most of the clinical courses were taken up. So out of the 1,190 seats that were available in round 1, paid seats quota in Tamil Nadu deemed universities, 1190 seats were available total, out of which 1,063 seats were allotted. So 127 seats are straight away vacant. So what will happen? These 127 vacant seats will come to round 2. So in case in round 1, you have not preferred some of these non-clinical courses, say for example, your score is lower. In round 1, you have not asked, but now you think, right? Okay, I am interested in forensic medicine. I want to join now. Then maybe in round 2, you can give option for this particular course. Or of course, there will be vacancies in almost all the branches. I'm not saying only these, but at least we know there will be minimum 127 vacancies will be. Okay, how many total vacancies will be there? We will know only after the deadline for joining the course. Then MCC will release the round 2 seat matrix. But as of now, we know minimum 127 vacancies will be there for round 2. I hope this information is useful to you. I know a lot of data, a lot of numbers. That's why I tried to avoid combining all the courses, all the colleges. But yes, you wanted, so I have done this. I hope you find this information useful. If you have any further questions, please leave your questions in the comments below. I will try to answer them as quickly as possible. Thank you. Bye-bye.